First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. A first aider is a trained individual who is able to give first aid to a sick or injured person. He or she is the first person to respond to an emergency. He or she keeps the sick or injured person safe until advanced medical treatment is given by a physician. Number 1. Calm and cool. During emergencies, a first aider should not panic. He or she should keep calm and have presence of mind so as not to startle the sick or injured person. Even though you will need to act quickly and decisively, it is vital that you stay calm. This will not only ensure that you make good decisions, but it will also help whoever you are treating to stay calm. Panic can cause further injury and delay treatment. Number 2. Work systematically. A good first aider acts based on standard procedures. He or she applies the knowledge and skills he or she acquired and learned from training. He or she works professionally and does not act based on instinct. So if you are first aider, you will need to use everything you learned in training. You need to act professionally and you should not be based on your instinct. Number 4. Observant. A good first aider must be able to notice all signs of injury or damage. This helps him or her to decide on what action must be taken immediately. This one is the most important characteristic a first aider should have. He or she should be able to notice all the signs and symptoms of what's happening to the patient. The responder should know how to comfort and ease the patient's pain, whether it's physical, emotional, or mental. Number 5. Resourceful. During application of first aid, a first aider must know how to maximize every possible resource present in the area. In the absence of first aid material, he or she must be able to use alternatives that will help alleviate the injured person's suffering. Last, number 6. Sympathetic. Being sympathetic leads to a comforting first aider. A first aider must keep the victim calm and comfortable during first aid. This will help the injured or sick person to relax. A first aider should use sweet and encouraging words to lessen the victim's distress. He or she should keep the victim as comfortable as possible and should be able to ally the victim's fear with sympathy. Number 1. Stay calm. This is the most important rule in any emergency situation because emergency situation can be very stressful. An already stressful situation can be made much worse when you don't keep your cool. Being calm and assessing the situation helps the patient relax while their injuries are being treated and stabilized until emergency personnel arrive. Number 2. Examine the victim. Do a primary survey of the victim. Assess his or her airway, breathing, and circulation, or ABC. Airway. The airway of the human body is one of the more important parts to be checked when providing first aid, and is typically the first item given attention in the seriously sick or injured patient. The airway is the entrance point of oxygen and the exit point of carbon dioxide for the body. Make sure that the airways of the victim are not blocked. Gently tilt back the person's head and lift the chin. This will enable the lungs to get air through the nose and mouth. Breathing. Breathing is needed if a person collapses and stops breathing. Look, listen, and feel for the victim's breathing. Observe if the person's chest is rising. Put your ear to the mouth to listen for and feel exhaled air, since chest movement alone might not mean breathing. Circulation. If the person involved in the emergency situation is not breathing, the first aider should go straight for chest compressions and rescue breathing. The chest compressions will promote circulation. This saves valuable time. Check for a pulse. Gently press 2 fingers on the person's neck between the voice box and the muscle on the side of the neck and feel his or her pulse. If you're checking the infant's pulse, gently press 2 fingers on the inside of the infant's arm between the elbow and the armpit. If you still do not feel a pulse, put your ear to the chest and listen for a heartbeat. Number 3, ask for help. Immediately call a doctor. Request other person in the vicinity to call a doctor on an ambulance to take the victim to the hospital. Number 4, do a secondary survey of the victim, from head to toe survey. Do not make snap judgment. Do not assume that the first injury you see is the only one. Examine the victim for other wounds, bruises, and shocks.